When she had that experience with the mammography and I came home and she told me about it, she was upset, and it sounded like an awful experience and not one that anyone would want to have. And that isn't the first time that sort of thing has happened.
Usually not quite this bad, but it was particularly bad back then. We quite understood how my body works, so they kept trying to force me into positions that I couldn't quite hold, and they kept having to repeat the pictures and look behind me.
The doctors kind of felt like I couldn't handle or didn't have capacity to hear about my own condition, and so I would leave the room and they would discuss what's going on without me.
If you talk with anyone who has disability, whether it's physical or cognitive or mental health, given enough time, you'll hear these kinds of stories. This is not an uncommon problem. It results in healthcare disparities, which are quite significant.
If people are going to live good, quality, successful lives in the community, even people with very complex disabilities, we're going to need to change how we deliver health care.
Hi, Crispy. I got your chai. Where do you want it?
On the table.
Okay. Good. So I also have CP. Our disabilities are kind of opposite. Like you want to be on the ground, and I have trouble getting down to ground level sometimes.
He wants to be up high.
And I want to be up high, yeah. So we sort of navigate that. It does actually, yes. We got married in 2012. We tried to incorporate our mobility devices into the wedding as much as possible. It was sort of our theme, and sort of regardless of how we did it, the question was going to be, well, how do we do our first dance? It just seemed better to both be on our mobility devices.
It was fun.
It was fun.
And there's Crispy already.
Morning. How are things going?
Pretty good.
Pretty good? Yeah? I'm going to check your blood pressure first, and then you can tell me what brings you in today, okay?
My current doctor, she's pretty good. She did a lot of times and listens to me and answers all my questions. But I haven't experienced with my left shoulder.
So, but kind of right in here? Okay. So let me try starting with the spine. Any pain there? Okay.
I feel comfortable enough
Any pain in here?
to correct her assumptions.
Between the scapula, this bone, and the spine?
I think she had other patients himself, so we all kind of along together.
Felt pretty good? Yeah. The thing about acupuncture is that it's
I was super good feeling real sick. 16 hours a day, all the time. I am physically active. I come in, I do yoga, I climb the stairs.
Often healthcare practitioners have the same stereotypes about people with disabilities that the general public holds. And unfortunately, in the healthcare context, it plays out in a negative way in terms of the quality of care people receive.
Frankly, a lot of doctors' offices are not set up appropriately for people with disabilities, and people struggle to even get in the door sometimes.
Frequently, primary care offices do not provide accessible medical equipment. For example, height-adjustable examination tables, accessible weight scales, accessible mammography equipment. And without this kind of equipment, it really is often not possible for somebody with a disability to be appropriately examined. For example, I had an echocardiogram recently, and it was done while I was sitting in the wheelchair, even though I knew it needed to be done lying on an examination table. And in fact, when the results came back, they had not been able to see a portion of the back part of the heart.
The healthcare system does not work well for most people in this country. And what you see then for people with disabilities, it just highlights all the underlying dysfunctionalities in the system.
You have 15 minutes to convince a doctor about how you live your life, and it's really on you to engage the doctor to try and challenge those misconceptions, because those misconceptions are going to impact the kind of care that you receive.
Any pain with that?
Yeah.
If I move it forward? Okay, what if we come up? How many hours are you in the chair during the day?
I'm not even fit of it. I get out call around at home.
Okay. I would say that it's a learning process. Part of it has to do with expectations or assumptions. I did make an assumption that Melissa was basically in her chair all day. And a couple of visits ago, she actually told me, no, I'm not. And I was surprised. And so it's not like I have her walking around in the room or, getting outside of the chair. And so for me, that was a learning moment. It was like, oh, next time I should ask the question, in terms of how you spend your day, how much of it is in the chair versus ambulating. So part of it is just letting go of assumptions and finding out what's really going on.
Hi, Melissa. My name is Ryan Delgado. How are you?
I'm good. How are you?
I'm doing well. Thank you for having me over here.
Right now I'm looking at a health advocate for the Office of Development of Primary Care. I think it's good for the medical students because they get real life exposure and they see all kinds of different environments.
I feel like this type of opportunity, being able to kind of go out, do home visits, meet patients where they live and see them in a more natural setting is pretty unique to UCSF. So I'm about halfway through the year. In your opinion, what is the biggest thing that I should know?
Building services.
Most of the day-to-day training is just largely limited to the clinic and 15-minute office visits, and you don't get the full picture of the patient.
Take a big breath in. As you exhale, press your belly toward the floor and draw your right knee in toward the chest.
It's absolutely important to be able to have these types of training opportunities in which we can see people with different abilities in their houses, in their home environment, because it allows us to understand as best as we can their perspective.
If that develops to the whole picture of who I am, it impacts the way we see me and the way we find a problem.
There's such a disconnect between the orientation of traditional medical and nursing education and the needs of people in the community right now. Because we train people largely in hospitals, and there's still a lot around that kind of biomedical model of curative medicine. And we need to shift that all to thinking much more about how do we help them to optimize their well-being.
The goal of healthcare is for people to be able to participate, to be well, not just free of disease, but to be healthy and to do the things that they want to do.
When I'm dreaming about the future, I want people with disabilities and families and supports to have higher expectations for what's going to happen. I'm hopeful that doctors will be allies to us and see themselves as supporters of this work in our own work to live independent lives.
All the office staff will be trained and not sort of see you differently, not patronize you. The appointments will be long enough that you can get your words out.
Yeah, and I work with my body the whole system. It may be like an atypical system, that stuff.
It may be an atypical system, so the standard rules may not apply.
Yeah. But I still need it to work for me.
But you still need it to work for you.
We're talking about sort of revolution, not just evolution. Frankly, it's not only really about transforming care for people with disabilities. It's really, that is a wedge to transform care in a way that everybody in this country would benefit.
Well, I've been working as a disability rights advocate for many decades, and I can say that there has been slow but steady progress bringing these issues to light. We can do it all in a better way, in a more efficient way that respects the individual and that recognizes these human rights that we all have and yet we're not seeing fully fulfilled